Hi, everybody. This is Allison with Safety Education Specialists, and welcome to 2025 AHA Guidelines Update video. So as my students know, for the last several months, I've been predicting that with this guidelines update, we were not going to have massive changes, and I was correct. So this is going to be the one video that I'm doing instead of like in years past where I've done a basic life support and a Heartsaver video separately. This time, I'm going to talk to all of you in one video. There's no need to make two. The changes were very minor. So first, the things that affect all of my students, my basic life support healthcare provider students, and my Heartsaver civilian level provider students. The first thing is when you come to take your classes, you're going to notice an increased emphasis on ventilation, that is breathing. We're going to be concentrating a lot more on getting proper breaths with good chest rise, not too much, not too little. The Heart Association noted through statistics that while survival rates did increase, and we had an increased rate of what's called ROSC, return of spontaneous circulation, there was a decrease in neurological outcomes. That means the brain was not as healthy as we'd like to see it after a rescue. And much of that was attributed to poor ventilation, either too much or too little, or a delay in providing ventilation. So you're going to notice in your classes, we're going to be discussing and practicing mouth to mouth, pocket mask, and for my healthcare providers, bag valve mask breathing more in class. The next thing you're going to notice is for my students who take infant protocols. So all of my BLS students and my Heartsaver students who take the infant protocols, they have now moved away from the two-finger technique for compressions. Instead, you are going to be doing either the two thumbs encircling hands technique or providing compressions with the heel of one hand along the center of the chest at the lower half of the breastbone. This was a change that was introduced in the 2020 guidelines, where they gave the two thumbs encircling hands and the heel of one hand technique as an option for infants. Now it is required. So whether you're one rescuer or two rescuers from my team CPR providers, it's the two thumbs encircling hands technique and or the heel of one hand. The next thing that is the same for all of my students is something special about AEDs, defibrillators. So this is more about provider comfort than the actual functionality of the unit. So if you are having to provide CPR and AED in a public place, and you as the rescuer are uncomfortable with removing a bra from a female patient in its totality, you may do your best to work around it. Now, keep in mind, if the AED gives you an error message and says poor pads contact or check your pads, you may not have a choice. That AED model may not be compatible with where the bra is on the chest, in which case you would have to remove it completely. However, if the AED does not give you an error message, it is safe to use an AED with the bra still in place if it is a matter of provider comfort. Again, it is preferred to be used on a bare chest, but if it is a difference between you trying to help a female who needs help or not, we'd rather you make the attempt and try to work around it rather than let the presence or lack thereof of a bra keep you from trying to help someone. Now, for my Heartsaver students, some very important things that I want you to remember. When you're looking at classes with the 2025 updates, if you are taking this class for your workplace or for any kind of licensure or certification for a state, a locality, the federal government, etc., you need to take what's called the Heartsaver Total Program. It must have the word total in the title. The total program is designed to meet OSHA guidelines and standards. That is the only Heartsaver version that is going to satisfy those requirements. Your certification for the 2025 updates and beyond, if you've taken the Heartsaver Total course, should also specify on it Heartsaver Total. Now, total does not mean that you're getting adult, child, infant, and first aid. You have different versions of all that you can put together. However, Heartsaver Total means that no matter which ages you're discussing or whether you're doing first aid or not, as the instructor, we have to show you and give you certain bits of information to meet that OSHA standard. So make sure if you're taking the class for any kind of licensure, you're taking the Heartsaver Total program. Another thing that you're going to see more of in these classes is the integration of naloxone. Naloxone is the opioid antagonist, which is used to reverse opioid overdoses. The brand name most commonly known is Narcan. So you're going to see this integrated more into the practice sessions and more into discussions. In some classes, it will still be its own standalone topic, but for all classes, basic life support and Heartsaver, you're going to see more integration and discussion of Narcan and opioids. We also have a big change that's come around with choking or a foreign body airway obstruction. So when the person is conscious and choking with a foreign body airway obstruction, the Heart Association has now endorsed doing 5 back slaps followed by 5 abdominal thrusts. And this is for all ages, adult and child. You're going to begin with the back slaps. For the infant, instead of doing the abdominal thrust, you're going to be providing the heel thrust to the chest. But everybody, all ages, are now going to be getting back blows. I'm going to ask you as my students, until you take a class, please do not just begin to slap people on the back. Please wait until you come to class so I can show you how to do it properly before you try to do it to somebody else or in another situation. But that is a big change. That is the largest change that I have seen with these guidelines. I think part of this has come with the increased cooperation between the American Red Cross and the American Heart Association. Those of you who've been taking AHA classes and or AARC classes for several years know that sometimes the Heart Association, the Red Cross, like to argue and butt heads a little bit. Some years they're cooperating, some years they're not. It seems like since 2024, the Heart Association and Red Cross have made a conscious effort to align their guidelines and their practices to make training more consistent. And I do believe, my own personal opinion, is that the inclusion of the back slaps to someone with a foreign body area obstruction who is conscious is one of those steps that was taken to further integrate the two sets of guidelines. In addition, for my Heartsaver students who are taking the first aid section and the CPR and AED section, you are going to see a new segment on water safety and drowning. This is, of course, not going to replace a lifeguard or having someone who's appropriately trained in water rescue. However, it is going to teach you some basic things you can do to enhance water safety and competency, not just for yourself, but for your family. We also have in the first aid section 2 brand new segments that are coming in. The first one is going to be discussing repetitive stress injuries in the workplace and ergonomics. This was put in to further align the Heartsaver Total program with OSHA guidelines and OSHA standards. So you're going to see a discussion about repetitive use injuries, force injuries, and things like that coming up in class. It is not intended to replace on-the-job training. However, it is meant to raise awareness and hopefully start those discussions within your workplace. The last segment that is the biggest change for everyone, this is going to show up in the Heartsaver Total program in the first aid section. And this is going to be a frank discussion of mental health and workplace violence. This discussion is likely going to begin, in my own opinion, it's going to start a social trend much like the inclusion of naloxone did about 10 years ago. So about 10 years ago, the AHA began to discuss opioids and naloxone in class. And this was a very uncomfortable conversation to have. I remember students being uncomfortable with the idea of opioids and drug overdoses and speaking about these things in class, and even having a frank discussion of death in class. Over time, with the use of this training and discussion during class sessions, people became more comfortable saying the word overdose, saying naloxone, saying opioid, until now I see where public access naloxone and frank discussions are happening all the time. And I believe that the inclusion of a discussion of workplace violence, mental health, and explicitly suicide is going to be very helpful. This is the first time I have ever seen the AHA mention the suicide hotline in a class and encourage that discussion. So I do believe that while these conversations are going to begin as something very uncomfortable, and something that nobody is going to really like to have in a CPR and first aid class, I believe that over time, it will create the same positive change and the same open discussion that we have seen around the opioid crisis that's evolved over the last 10 years of its inclusion in classes. So, to my students, this has been your 2025 AHA Guidelines Update video. I will see you in your next class. Stay safe and be well.